Complex regional pain syndrome, otherwise known as CRPS, is somewhat uncommon. This condition has also been called reflex sympathetic dystrophy. This neuropathic pain syndrome can develop after an injury, infection, surgery, stroke, or even heart attack. It may involve both peripheral and central sensitization. This pain syndrome is rare, complex, and presents with overlapping signs and symptoms. An injury to the body may initiate CRPS, but the reasons why some people have this response while others do not is not completely understood. It is hypothesized that the cause is due to an anomaly or injury to the nervous system that triggers symptoms, including an inappropriate inflammatory response. The pain is often out of proportion to the initial injury. It may be a form of chronic pain that usually affects an arm or a leg, but can present anywhere on the body. The symptoms a person with CRPS may experience are burning pain, usually in the arm, hand, leg, or foot. Throbbing pain, usually in the arm, hand, leg, or foot. Sensitivity to touch, heat, or cold. Swelling of the painful area. Changes in skin temperature, alternating between sweaty or cold at times. Changes in skin color, ranging from white and blotchy to red or blue. Changes in skin texture, which may become tender, thin, or shiny in the affected areas. Changes in hair and nail growth. Joint stiffness, swelling, and damage. Muscle spasms, tremors, and weakness. Atrophy of muscles. Osteoporosis in the area affected. Decreased ability to move that affected body part. Symptoms may change over time and vary from person to person. These symptoms can resolve or may be progressive. The affected body part may become cold and pale. Some changes may be irreversible. Occasionally, CRPS may spread elsewhere. In some people, complex regional pain syndrome resolves on its own, while in others, it may last months to years. Treatment is most effective if started early. Improvement and remission are possible. Diagnosis begins with your doctor examining the areas where you are having the symptoms, and will also examine your history to determine the cause of pain. There are no diagnostic tests that determine CRPS, but the following procedures may be helpful in diagnosing. Bone scan. This procedure might help determine bone density or changes. A sweat production test. Some tests may measure the amount of sweat in the area. Uneven results can help indicate CRPS. X-rays. Loss of mineral from your bones in the affected areas may show up on an X-ray in the later stages of the disease. An MRI, magnetic resonance imaging, may show tissue changes and may help rule out other conditions. CRPS is treatable by a medical professional, but symptoms may last years or even be lifelong. Medications can reduce the signs and symptoms. They may include pain relievers. Over-the-counter or prescription pain relievers may be suggested. Various topical treatments such as over-the-counter or prescription pain relievers. Topical analgesics. Various topical treatments such as creams, ointments, or patches are often used. Antidepressants or anticonvulsants are sometimes used to treat pain that originates from damaged nerves. Corticosteroids. Steroid medications may help reduce the inflammation and improve mobility. Bone loss medications, sympathetic nerve blocking medications. Injection of an anesthetic may relieve pain in some people. Intravenous ketamine is a strong anesthetic and may substantially alleviate pain. Medicines to lower blood pressure. Sometimes high blood pressure medications can help to control pain. These medications have varying degrees of efficacy and all have side effects. Other treatments include therapies such as heat therapy, physical or occupational therapy, mirror therapy, transcutaneous electrical nerve stimulation or TENS, biofeedback, spinal cord stimulation, intrathecal drug pumps, or acupuncture. If you've tried these methods to no avail, Or if you just don't want injections or medication, a new treatment to consider may be Kalmar scrambler therapy, a neuromodulation method that delivers impressive results of approximately 80% efficacy. These results are often more effective than other modalities. It is important to receive care and treatment. Take proactive measures to help manage your symptoms by eating healthy, avoiding excess toxins, exercise, and taking care of those parts of the body such as your feet. All of these suggestions will help you manage and take empowered action toward your healthcare goals.